The overall rate of HIV diagnosis in the UEA has declined by 16% since 2014. However, new HIV diagnoses, that means excluding previous positive known diagnoses, have increased by 12% from 2022 to 2023. This increase can be attributed to several factors. One of them is the increased diagnosis among migrants arriving from countries with higher HIV prevalences. Also, the expanded HIV testing services leading to the identification of previously undiagnosed cases. This year, we have different trends. 90% of the cases that have been reported in 2023 are due to sexual contact, and we are seeing an increase in heterosexual transmission compared to previous years. Sex between men is still an important mode of transmission, accounts for 46% of all the cases that have been reported with known transmission mode. However, heterosexual transmission is increasing and is changing the pattern of transmission mode in the UEA. Also, one of the key populations that we are seeing or is emerging is the migrants, as almost 50% of the cases that were reported in 2023 are among migrants. And those migrants are coming primarily from Sub-Saharan Africa, Central, Eastern Europe, and Latin America, and the Caribbean. People who inject drugs is still a key population, but in this population what we are seeing is a decreasing in the number of diagnoses. That means that all the harm reduction services and the programs that are targeted to protect these people to get infected are in place and are working well. One of the big challenges that we are seeing with the current data is that almost 53% of the cases are diagnosed late. And this is really important because this means that people have been living with HIV for many years, leading to poor health outcomes, increased transmission risk, and higher healthcare costs. Also, one of the problems that we are seeing is stigma. Stigma is still a big problem for those that are living with HIV, because the stigma can prevent individuals from getting tested and accessing care. Migrants face different barriers to access healthcare, including language barriers, cultural differences, and legal status. What we need now is to use the data we have to tailor the strategies. Still, we have incomplete data, and we need to work on increase the information regarding transmission route, places where the people is coming from, to tailor the strategies that are made to prevent, to lower the barriers to testing and for treatment.